Hello, I'm Tiffany, and before we meet, I just wanted to take a few minutes to walk you through some of the most common questions and concerns that people have before starting their work with me. Because chances are you're not starting from scratch here. You've done some research. Most people I speak with have also already tried quite a few things to help improve their sleep, mouth breathing, and their snoring. Could be CPAP machines, nasal strips, mouth tape, different types of pillows, mouth guards, and maybe even some exercises that you've found online. But if you're here, it probably means one of two things. Either those things didn't work, or they didn't feel like they were in a way that felt sustainable for you. So let's talk about that. Let's start with, I feel like I've already tried everything. Okay, this is probably the most common thing that I hear. That's why I'm starting with it. And the truth is, you might have tried a lot, but most of those approaches are focused on managing symptoms and not addressing the underlying patterns of the issue you might be suffering. So what I do is different. I look at how your muscles, breathing, posture, and habits are functioning together and retraining those patterns in a structured way. So it's not about trying more things. It's about doing the right things in the right sequence with my guidance. So many people choose to do the self-paced program. And so they wonder, well, if I'm doing a self-paced program, can't I just follow exercises online on my own? Well, it's a really good question because yes, there are exercises out there, but the challenge isn't just knowing what to do. It's, are we doing them correctly? Are we doing them consistently? And knowing when to progress. And not just when to progress with certain exercises, but what exercises to start with first so you get the proper brain and muscle training. So many people that I have seen have tried it on their own, but they're either not activating the right muscles or they stop before they actually can see any progress. And that's where structured guidance makes a big difference. Health coaching has been proven to be 70% more effective for clients to reach their goals than when clients try to do it on their own. Another question, and this is reaching a really emotional component, is I'm not sure this is going to work for me. So if you believe you can, you can. And if you believe you can't, you're right. Because we have to trust in what we're doing. We have to trust in ourselves. And part of what I do is really bringing that self-care component to your program so you can. And if you don't think you can, I can help you get to the point where you know you will. Okay? So important. So will this work for me or not? I completely understand where you're coming from. Especially if you already have tried a few things already. So what I look for in a call is whether your symptoms and patterns are something that myofunctional therapy can actually help with. And if it's not a good fit, I'll tell you. But when it is, then the results will come from consistency and proper guidance, not a quick fix, not impossible to find the results. Just commitment. And again, I help you with that. So another question is the cost. The cost really gets people. And there's a cost of doing something, and there's a cost of not doing something. So we have to determine what's more important to you. The cost of continuing on the path you're on, or the cost of making that change so you can look, feel, think, and perform better. So I don't look at this as a cost. All of my education, whether it's professional or personal, is an investment in my future. I don't want to continue to build up debt. That's the negative side of not taking action. I want to invest. I want my investments, my decisions to grow with health and happiness. And so investment versus cost is a really good question to consider. And I want you to know that the programs that I offer, it's not just information, exercises to go do. It includes that, but it's specifically structured with step-by-step processes and coaching and motivation and accountability all built in. So that's 24/7 access to questions and answers that you might need between sessions, which is unlike what you're going to find when you're seeing a practitioner, because you meet with them at your set times. You do the work at home. You're expected to do the work, and you just try your best. Doesn't always work. So I don't leave you left to figure it out on your own, okay? And that is great for a lot of people. It's really the difference between something that sounds helpful and something that actually creates change. So what happens next? Well, when we meet, ideally through a Zoom link that gets attached to your appointment request, we'll talk about what you've been experiencing, what you've already tried, what has and hasn't worked for you, and whether or not we think this approach makes sense for you. There's no pressure to move forward. The goal is simply to give you clarity, so that way you can make the best decision for yourself. And if it's a right fit, and I feel like I could provide value to you, then we'll talk about what that can look like for you specifically. Oh, I probably should have followed this question up after the investment question, but why does it cost what it does? Okay, I want to speak to this directly. I don't want to keep costs and everything away from you. I want you to be knowledgeable and understand the investment that you're going to make, because it's something that a lot of people are thinking. And even if they don't want to say it out loud, cost is a value that we have to secure in ourselves to know whether or not something is worth it. So when you're comparing this program or one of the programs you get to constant purchasing of nasal strips and mouth tape, or the cost of the time you spend researching exercises, wondering if they're doing the right thing for you or not, that's a cost as well. And it can feel overwhelming and like it's too much. And that's completely fair. But the difference between tools and pieces of information, the program that I offer, is that I'm going to change how you're functioning over time. I'm going to reduce the cost of products that you have to repurchase and put in the waste over time. Okay, so you're not just getting exercises, you're not just getting information, you're getting clear progression, support, adjustments that your body needs. And that guidance for most people is what makes the difference. So spending between $1,000 and $3,000 is what you can expect to have the results you're looking for. Okay, that price varies because it depends on your values and the way that you can work. Some people can work on a self-paced program. Some people need one-to-one. Some people need additional tongue tie support, TMJ support, or breath and posture support. So my programs can range between $1,000 to just over $3,000. Okay, so that is the investment that you could expect, and we can discuss payment plans as well to make it more feasible for you. Okay, this is a good one. Legitimacy. My doctor hasn't told me about this, so it must not be important. My dentist hasn't pointed out the signs or the symptoms for me, so I must not have these issues. Well, this is an important and common question, and it does make sense. We're used to turning to our doctors and our dentists and those professionals that we believe have all the information that we need to make the best decision. But the reality is, myofunctional therapy is not widely understood or integrated into other areas of healthcare. So it's private, which is different than many care systems, is it's not well recognized right now, like chiropractic work, which again isn't always supported, or physio or OT. It's another modality that's newer. It hasn't made it into the medical care system. And so doctors just don't know unless they have specifically dealt with issues with themselves and their own family. That's why we all get into this, is because we are the people that need this support. And when we get the results, we can't help but share it with others because it is so impactful. So in many cases, the approaches that have already been offered for managing symptoms, like the CPAP machine and oral appliances, that's just what they know. And that is why they refer and recommend those. Myself and all of my education for dental hygiene training, I would go learn new things, but I wouldn't have the confidence to implement it until I did that many, many times. And sometimes it could take me years to implement new dental hygiene processes. And so it's no different. I've worked with dentists that know the importance of this, but don't feel comfortable answering questions about it because they don't know enough that it makes them feel stupid. And so they just don't even refer out to a professional who could explain it more. So sadly, the ego stops professionals from reaching out to this new modality for their clients because they don't know how to answer the questions the clients might have. One good thing is that if you have a sleep study, there may be a recommendation on optimizing your airway. This is where myofunctional comes in. Okay, it's out there. It's just people don't know what it actually means or where to refer people to. And depending on where you live, there may not be someone to support you. That makes it even more challenging to get the care that you need. So part of what I do is I help bridge that gap between oral health, systemic health, airway health, and growth and sleep health. Just fill you in here. We spend a third of our time sleeping in our life, yet doctors learn less than 10 hours of education. And I am being very generous when I say 10 hours of education on sleep, yet it's a third of our life. That sounds like it should be something that doctors learn quite a bit more. But sadly, we are in a disease-based model. We're treating diseases. We're looking for symptoms for diseases. We're not really looking for the preventative side and how the whole body works together. So when we do meet for a call, and I look forward to chatting with you, you've went through this so you have some information. That way you know exactly what we're going to talk about and we can walk through it all together. My goal is to always help you understand all the options clearly and not push you in one direction or another. Okay? If you've gotten this far and it's not for you, I will let you know if this call is not for you. Okay. How about I start with the approach is good fit if you're someone who, it is not a good fit if you're someone who is looking for a quick fix or something that can change overnight. It's not, this call and this therapy is not for you if you're in a place where you cannot be consistent with small daily habits. It's also not for people who are hoping for a completely passive option where you don't have to be involved in the situation. Okay? It takes work, it takes exercises, movements, dedication. Okay? It takes consistency. We have to retrain our brain and our muscles. And that is what makes meaningful change. So if you're someone who is ready to understand what's actually going on in their body and take an active role in improving it, then this is a really powerful approach. This call is for you. This therapy could, based on our conversation, be for you. And if you're not sure where you fall between is it for me or is it not? Get on a call. We can chat about it. I can help bring clarity. So at least you know moving forward that you've done what it takes to make the change that you're looking for. So I'm really looking forward to speaking with you and potentially working together should you be a candidate for myofunctional therapy and my approach.